Hello, people. Okay. All right, let me just make sure I've got everybody. Okay. Hi, this is Katie Kleber, and wait, there's Jerry. What's up? There's Jerry. And then here's John and Emily. They're helping me out here. Oh, and Max down here. They're helping me get questions. So if you guys have questions, please type them in the comments, and then I'm going to go through some points about new grad interviews. And then if I have not answered your question, we'll go back to it. But I'll go through the kind of tips I have in my background, and there is a cheat sheet in the description. It's my verbatim exact notes that I'm going to go over, so don't feel like you have to like quickly write things down. Just go get your cheat sheet. You good? You have to go to scroll down to like Facebook, their Facebook. Hold on, let's make sure we got it.
Sorry guys, user error.
User error. Did you refresh? Maybe not.
I did not refresh.
Refresh. Okay, so I'm gonna get started. It's gonna take me a second, so you guys kind of do some troubleshooting. Okay, so first of all, I went through here. Wait, let me get Jerry in there. There we go. Jerry usually watches over Hannah, but he's not right now because he's just downstairs. So I figured, hey, why not have Jerry here? So I obviously did new grad interviews myself. I went through the process myself, and then I also now I interview new grads with my unit, and I also kind of I know some people that it's kind of creepy that John, I can see me on the other computer. Anyways, and then check out that, yeah, there's the link for the cheat sheet. So I've done the interviews, and then I also have kind of talked to people that are really do this frequently. I do it intermittently, but people that do it a lot. So, and I know some HR people, and talk about the process, what people look for, what I've looked for as not just an interviewee or an interviewer, but also a coworker. Like, what am I looking for in someone that I want to be working with me? So let me go through my points. First thing I want to say, though, that view is just really funny of Jerry right there. I like that. Okay, so the first thing I want to say, these are tips. These are things to help you land your first job. This is not stuff to like live or die by. I am sure people have gotten jobs out there by not necessarily doing these things, but something to keep in mind, though, if you're like trying to do interviews and trying to just do the minimum, you could be not getting jobs and not landing jobs. And if you're kind of messing around doing the minimum and not getting jobs, that's time you're not working, time you're not getting paid. Like, so it's really important to really put all you can into all the interviews so that you can get a job as quick as possible and start working as quick as possible, right? So kind of doing the minimum really isn't an option in my mind when you're doing new grad interviews, especially because the market is so tough right now. John was saying that there were hundreds and hundreds of new grads applying for very, very few positions. You have to do what you can to stand out. So let's say you're getting to the point where you've gotten your interview, okay? So these are my tips. Number one, the interview starts before you arrive. So I'm calling to schedule an interview with you. Are you courteous on the phone? If I leave you a message, is it taking you 4 days to get back to me? Is it hard to get an interview scheduled? Am I saying, hey, here's 3 or 4 dates, and you say, nah, none of those work, and you're not making this a priority? I'm already kind of learning a little bit about you is it really tough to schedule an interview? So that's really, really important. I realize people have stuff going on in their lives, but if this is a priority, it shouldn't be like pulling teeth to get an interview scheduled or you calling back, rescheduling multiple times. So that's tip number one. And then actually I went over these tips with Emily and John, and they both had really good points to add. And one of the things that Emily reminded me of is Google yourself. Employers will do this, and people don't get jobs because of their online presence. I'm not saying don't be online. I mean, everybody pretty much is online, but take a quick second to Google yourself. If maybe your Facebook is private, well, if you still can see your profile picture, probably your cover photo. If you have something kind of crazy there, I mean, and that's the first thing people see when they look you up online, that may deter people from hiring you. I mean, whether or not that is fair to whomever, but keep that in mind, what you look like online. That's really, really, really important. The next tip is every single person matters. So from the person that you walk into, the receptionist of maybe the HR department, or maybe if you're interviewing on the unit, the nurse or the CNA that comes to get you from the front, and brings you up to do the interview, if you're like not trying to even say anything to them, or if you're on your phone, not trying to make any conversation, or maybe we give you a tour of the unit and you're really like closed off, or really like don't give this great impression. Not necessarily, you don't have to be this like overwhelmingly courteous and amazing person, but if you're just kind of rude or standoffish, that speaks even if you don't. So that's really important to keep in mind, is the impression that you're giving, not just the person you're interviewing with, every single person that you're coming into contact with. So that's really important. And don't think that just because if you're a shy person, that doesn't mean you won't get a job. I mean, I've interviewed very shy people, but I can see through the shyness that they're a good candidate. So don't think that just because you're shy you can't get a job, and you have to make these amazing first impressions. Just don't make a really bad one by being kind of standoffish or rude, or not, taking the time to say, "Hi, my name is Katie. I'm interested in blank position. What do you think of the unit?" or stuff like that. Next one. This is pretty obvious, but it's important because people don't necessarily follow it. Dress professionally and come prepared. Have one of those portfolios that, if you didn't see that last video that John did, the leather-ish portfolio. Have that with some extra copies of your resume put on resume paper. We may have your resume already printed, but if you are able to say, "Oh, hey, I've got, a fresh one here. Here's an updated thing of my references," something like that. That looks great. If you look polished, professional, and you're in a suit, not a polo and khakis, you're in a suit with a tie, or you're a female still in a suit, I mean, that tells me you're serious about this job. You're putting effort into looking professional and appropriate. That speaks pretty loudly, more so if you don't, if you're not putting any effort into looking professional, that tells us something, that maybe you're not taking this super seriously, that you're just kind of seeing what happens. And let's see, let me make sure I go over everything on that one. Oh, something that's really important that I recommend, let's say you're going to do your interview, look up the place online first. Get to know their mission, vision, values, things that are important to that organization, and have questions that you want and that you can integrate throughout the conversation, and mentioning those. And that tells me, hey, you've done your homework. You're looking up. It's not just you showing up to interviews trying to see what kind of job you're getting. You really are invested in this, and it's important to you. Because this is important to me, I want to see that it's important to you too. Sorry, I'm not supposed to point. This is important to you. My next one, be confident but not cocky, okay? You're interviewing, and I want you to be interviewing and speaking like you have something to offer me, have something to offer the organization. You are confident while you might be a new grad, you got something to offer. And so that is something that if I can hear and see confidence in people, even if they're shy, even if they're scared, even if they're timid, I can hear and see confidence in people. I keep forgetting Jerry's back there. So there's a difference between that and being cocky. So keep that in mind, because I can also tell when someone is being cocky and not confident. And being a new grad is a very humbling thing, and you really kind of have to earn your keep when you're getting on a unit as a new grad. And if you're walking in there pretty unnecessarily confident, that also speaks. So you gotta have this I like to say humble confidence when you walk in and when you're talking. Like I interviewed someone, she was very, very nervous, but she had great answers. Even though they were through a shaky voice, They were great answers. And we got done with the interviews for the day, and it was like, yeah, she's real timid, but man, I was impressed with what she said, even though she was timid. And I feel like once she's comfortable, she's going to be a rock star. So just because, you know, you might be nervous, you may have some great things to add. So keep that in mind. Next one, always have questions at the end. I can't stress enough how important that is. It shows that you're not just going through the process. It shows that you care. It shows that you're not just like, nope, I'm fine, I don't have any questions. Like John mentioned in that last video, have that portfolio open and then have and that's what I've done, have a list of questions. What's your nurse to patient ratio? Has that changed recently? How often are you running within your matrix? Where would I float? Do you offer any continuing education, or not continuing education, like tuition reimbursement, like those kinds of questions, things, specifics about this job that are important to you that, I mean, in the interview, we're not going to answer all those questions for you necessarily. Like, we're not going to go through all every little question that you may have about this job. The interviewees aren't going to necessarily provide every aspect of that. So, like one time I did an interview as being interviewed and I had all these questions written down, and I actually didn't have questions at the end because she answered all of them. But I had them written down and kind of, you know, checked off, hey, this was answered. So she saw, hey, I have a bunch of questions I want to get answered. And they were, thank you for addressing all those questions or something. So it's really, really important to have questions at the end. And it looks wonderful if you have them written down to make sure they get answered. So that's a really important thing. I have another one. Don't throw others under the bus. I interviewed somebody once, and you know, typically it's like, tell me about a patient experience in nursing school. Tell me about a time where you had to do service recovery. Tell me about a time where you had to advocate for a patient. But every time it was like throwing other people under the bus. So I came into clinical, and the last shift nurse, he just didn't get things done. He missed this, he missed that, and we had to do this and do that. And it's like, I don't care what this other person didn't do. I want to know about you and what you can offer and how you did, not how someone else screwed up. Like that really, answering questions in that way really put me and everybody else off about, you know, that's not really adding value or really answering the question, you know? And going along with that, when you ask the questions like weaknesses and strengths, have genuine, legit answers. Be yourself. Maybe if they ask you a question where you don't have a service or don't have a great example, tell me that. You know what? I actually haven't had a point where I have actually stood up and advocated very clearly for a patient, but you know, maybe have some other example that can relate to advocacy or something you learned about it, or maybe a personal example, like, you know, and have real weaknesses. Don't say, I work too hard, I care too much, or what else? What are Michael Scott's weaknesses? I work too hard, I care too much.
Overinvested in my job.
I'm overinvested in my job. And then my weaknesses are my strengths. Yeah, don't do that. That's a terrible idea. But, we can really tell when people are giving us recycled, rehearsed, really not genuine answers to those questions. Okay, next one. Even if this job is a potential stepping stone, do not treat it like one. I was talking to a nursing student once who was telling me about doing clinicals on peds, or I think it was peds. I don't know. I don't remember what it was. They were doing clinical on a unit that they had absolutely no interest in ever working on. Hey, that was me. I was doing clinicals in units I knew I was never going to work on, but they were super not nice to the people that they were working with because they didn't want to work there. But to be honest, like no matter what unit you're on, even if you don't have a desire to work there, or maybe if you only want to work there for a little while to get some experience, everybody deserves respect. And you got to treat them that way, even if you have no desire to work there. So even if you're maybe want to be an ICU nurse and you want to be maybe an emergency department nurse, but you're working on the floor and you're putting in your time to be able to get there, don't treat this interview, this job, the people that work there like it's like, oh, I can't wait to get to the ICU. I can't wait to get to the emergency department. I can't wait to get to here, because that really puts people off. And if you're so concerned with that next step that you're not going to put in the hard work here, that can be very evident in interviews. And if you guys have any questions, please comment, and then I'll go over them when I'm done with my points. And maybe I'll try and think of a couple other, if there's any other interesting things. And then my next one, my last big point is, at the end of the day, talent and experience isn't everything. Okay? Some people think, hey, I've never worked in a neuro ICU before. I don't think I could ever get that job. I didn't do a clinical there. I have never worked there as a tech. Like, I might as well not even try. But speaking of some of the interviews, people, if I have someone in front of me that has 2 years of neuro ICU experience, they show up late to the interview. Their resume's got an error or two on it. It took a while to get it scheduled. They didn't have any questions at the end. They didn't really put in effort into the interview. And then I've got this new grad over here that I could schedule it very easily. They were kind and courteous on the phone. They were really professional for the interview. They made a really good impression. They just kind of immediately stuck their hand out and asked for, firm handshake from everybody. Hi, confidently saying, hi, my name is John. I'm, interested in this position. Want to hear what you guys think, And I could tell that they were passionate, and maybe they didn't have neuro ICU experience, but maybe they knew some stuff about the neuro patient population. Like, I've never worked in a neuro ICU, but ventricular drains really interest me. And, you can tell they've used some of the right buzzwords where they kind of, they've at least looked something up and they're kind of interested in it. So that would speak way more to me as someone who's interested, or someone who's going to be looking for someone to join our unit. That I would be much rather have that person as a team member. While it might take a little bit longer for them to be competent on their own, they're going to be a lot more reliable to me as someone who's maybe got some experience, but they're checked out. They're just here for the paycheck. They're just doing what they have to do because they know how to be a neuro ICU nurse or whatever. So, and I don't know if you guys have ever seen this thing. There's this image that's on Facebook. It's gotten shared a lot. It's things that take zero talent: being on time, having work ethic, effort, body language, energy, passion, attitude, being coachable, doing extra, and being prepared. That is just the epitome of what you got to do for these interviews, what you got to do to get an interview, what you got to do to succeed as a nurse and be someone that is desired by employers, and make it easy for you to get a job if you are coachable, if you can respond well to constructive criticism, if you're going the extra mile, if you're working your butt off, if you're not understanding something and you're taking time in your time off and trying to learn more about, like sending our preceptees home and, hey, here's homework about how to do this. One time we had one wonderful nurse today, but she was a new grad, and it was a lot to start in the neuro ICU as a new grad. And she would we'd say, hey, we're going to be talking about mannitol today. And she'd go home we gave mannitol. She'd go home, she'd look up mannitol, and she would, hey, here's what I learned about mannitol last night. That's a big, that person we want to work, they're working hard for us, we want to work hard for them. So those are my tips. Oh, and also another thing, and Emily pointed this out that I really, really liked it. You can also, by those things that take zero talent, you can also lose a job that way too. Those things that take zero talent, that anybody can do this, people can really lose jobs that way too. So it's really important to make sure that you're doing that stuff, and it speaks really highly to the people that are interviewing you and then the people you're going to work with. All right, do we have any questions? I saw some come through, but talking and reading is not cool.
We do.
What do we got?
Well, some of the other ones that actually just kind of disappeared were, how do I keep from saying in an interview? This person recorded themselves and they said it way too much.
Oh my gosh, have you guys seen my videos on YouTube? I say all the time still. So what, the more you do it, the more relaxed you are, and the more you kind of are practicing maybe questions. So I would look up online, look up some questions, and it was really helpful for me because when I'm in like a stressful, and I consider these kind of stressful situations, when I'm in that situation, it really helps me to look up and try to have patient experience stuff in the back of my mind. So I remember actually my very first new grad interview, I looked up online some typical nurse interview questions like, tell me about a time when you had to advocate for a patient. Tell me about a time when you disagreed with a care plan that was established and how you handled it. And so I looked, those were the questions I actually got asked, but I was able to, beforehand, I looked up some questions online and tried to get some patient experiences fresh in my mind. And in my little notebook that I brought to the interview, I had them actually written down, like just a couple buzzwords, like, ER patient with, bad pain management, called physician that was really mean to me, and that, okay, I can recall that. So having those kind of things on the back of your, or not on the forefront of your mind that you've thought of recently that you can recall easily, will kind of, and I just said, will help you flow through sentences easier because you're recalling this thing, and try not to like have this verbatim, I'm going to say this, so you can go back to them and just kind of say them. But I'm speaking as someone who's interviewing people. I'm not counting how many times you're saying I mean, it looks great if you can fluidly talk, but people do that when they're nervous. I'm not gonna what's up?
Just letting you know the way this is worked, the comments will erase. Yeah.
You can't scroll down at all?
No. So
I see some on here.
Yeah, there are some, but they erase. You can only have 4.
Oh no.
So if your question doesn't get answered.
I see lots of questions on here.
NRSNG on Instagram asked some questions, but
okay. Can you get hired as an associate, associate nurse, and do you have to take Med-Calc to get hired into a hospital? No. I mean, if you graduate, if you have your nursing degree, I can see them on my end. Okay, if you have your nursing degree, and this is my other thing too, if you have a nursing license, you're passing your NCLEX or whatever, I assume that you meet this base.
Okay, we got it now.
You guys good? You got it? Okay, I'm sorry. We're going to get this. Okay, and this may answer a couple other questions. My helpers here are not so helpful, but it's okay. So if you are a nurse, I assume that you have passed these various things and you have this basic level of knowledge and you've completed this base level of clinical hours. So if I'm looking at your resume and you have every single clinical hour listed, not necessary. If you're interviewing for the neuro ICU and maybe you did a specific amount of clinical hours in a neuro ICU, that would be good to have on there. But don't list out, oh, I did blank hours in peds, I did blank hours in the ED. Like, I don't care about that. You're a nurse. I know you in nursing school went through various clinicals. You can get hired with your associate's degree, absolutely. But most hospitals now, because of the whole international, or I can't remember, the IOM, their push for nurses, 80% of nurses have their BSN by 2020. Most hospitals are saying, hey, you either have your BSN upon being hired, or if you have an associate's degree, that you have a timeline of when you're getting your BSN done. And and it would be good to have that timeline outlined before you're starting your interviews, because you will be asked that question. So you can get a job. It is a little bit more challenging with an associate's degree, but that also really depends on what market you're in. If you're in downtown Chicago, you're not getting a job without a bachelor's. That's just the way that's working. If you are in someplace that's maybe a little bit more rural with a bunch of ADN programs around, it's going to be a little easier for you to get a job. Really depends on the marketplace. All right.
We got lots of questions. And
wonderful. And you can't see them. Great. Okay, go.
So in addition to all of those things you mentioned, is there any special tip you have to stand out from other people in an Or is that pretty much covered?
That covers a lot of it, because you would be surprised how many people kind of show up maybe not dressed super professionally, or, you know, so I really feel like if you're doing these things, you're standing out. And if you're looking up stuff about the unit beforehand, and I keep referring to neuro ICU because it's what I know, but if you're interviewing in a regular ICU and you're like, maybe you've never had experience in an ICU, but I'm really interested in getting really good at ventilators, and I'm really interested in ARDS, and I'm really interested in pneumonia and the septic patient. You start dropping those little buzzwords to me that tells me you care, you're looking it up, and you're not just doing every single interview and hoping you get a job. So I think that would be great, is looking up whatever patient population and things about that specific unit or that patient population and things that apply to them. So that would be, that is something that when we went through all our interviews recently, it was like, hey, she kept talking about very specific neuro stuff. And while she didn't have a lot of neuro experience, I think this person only shadowed in a neuro ICU. But she was, you know, I was really interested. Oh, wow. And I really liked this person, the way she said her weakness. It was an honest weakness, and I loved it. She said, I am not comfortable with death. And I know that's not a great thing for an ICU nurse, potential ICU nurse to say, but it's not something I'm super comfortable with, but I am. And I only had one death, and it was really challenging and really emotional for me. And I know I'm going to need to do that. And that's definitely a weakness of mine. And I was like, I respect that. Like, death is a really tough thing as a nurse to deal with. So for her to just, you know, hey, this is what I struggle with. And hey, a lot of us do too. And I appreciate that honest answer. So on honesty and being genuine, we can really tell. That will set you apart. What else we got?
Okay. Should we be concerned about red flags like high employee turnover, or just focus on getting that experience even if the organization isn't so great?
That's a great question. I think you know, like I said, you want to be, you have something to bring to the table too, especially, you know what, if you know you're a good worker and you're an asset to a team, and it's like, you know what, when work somewhere, I'm loyal and I want to stay there, and I know it's important. So I would do your research on that stuff, and that's important for you to know in the interview. Hey, what is your turnover rate? And just so you guys know, an average national turnover, the national turnover rate is about 15% roughly. So if they tell you that their turnover rate is 30%, that is a red flag. It is, if it's between getting a job and not getting a job, that's one, you know, that's one thing. But if you're interviewing at a couple places, ask them all what their turnover rate is. It's very important for you to know. And hey, has that changed a lot recently? Like maybe they were, you know, 16% last year, but they're 20% this year. Hey, what's going on? Did you guys have any changes? Like, what's your matrix and what's the what are you supposed to be running, and how often are you running in that? And if it's pretty not doable for you, you know, and you would have a little bit more life quality being somewhere else, maybe, like, because I'm someone where I love the neuro ICU, but if I was getting to a point where I could not handle it, if I was getting tripled every day and it was just too stressful for me, I'd rather work in a clinic, and I'd rather do something maybe not ideal, but where I'm not losing my mind every day. So you got to make that choice, and I think that's a question that you can answer. You got to ask yourself that question: maybe this might be not ideal, but is it worth it to me? And I can't really answer that for you. I'm sorry. Say all that to not really answer the question. Next.
Okay. Can you begin working in a hospital while you're in nursing school?
Absolutely.
And as what?
As what? Great question. Okay. Best thing you can do is as a CNA. A lot of nursing schools require you to get your CNA license, so that may already be done. But if I'm interviewing you and you have experience in a hospital as a CNA, check mark. I like that. You already know what it's like to work in a hospital and chart. And in a specific hospital, you know what it's like to work on a team of nurses. You're not a team with nurses. You're not necessarily the nurse, but you know what that flow is like. That's the best thing you can do. Other options are volunteering in a hospital. You can be a receptionist, a admin, a transporter. If you speak another language, it's a great idea for you to become a medical interpreter. It pays really well. Pays really, really well, especially if you work in an urban area. If you can speak Spanish and you can take, all you got to do is take this exam, and then you can be a certified interpreter. That's a wonderful job to have, and that looks outstanding on a resume. So those are a couple options. What else you got? I'm trying to answer these quick, guys.
I always
Quick.
struggle stating weaknesses and feel they may be taken in a negative light. Do you have suggestions for how to phrase them? What weaknesses do you answer with? Basically, she wants to know what your weaknesses are.
Okay, my weaknesses. Well, the last time it was like, I don't have experience in critical care. Gosh, you guys are putting me on the spot. So I try to really think about, really, like, truly, if unedited, what am I not awesome at? Like, and like that one chick answered, I'm not great with death. And hey, and you know what? Like, working in critical care was a really tough transition, and I think I mentioned in my last interview, because that was 4 years ago. So you don't want to put yourself in this super negative light, but if it's something that we can work on and get better. Hey, I have no experience with arterial lines, ventilators. It took me a little while maybe to get my feet under me as a floor nurse, and I'm a little nervous about my transition as a critical care nurse. But you know what? I am a hard worker, and I'm determined to do better at this, or something like that. Like, you can really put a spin on things. Maybe you can, like, the death thing was good. Maybe prioritization. You know what? I know prioritization is a big thing, and I know I'm going to have to really figure something out with that, and maybe I can get freeze and not know what to do, and I just freeze and I don't know my next steps, and when I get overwhelmed, that's not, like, truly honest. Hey, it's tough for me, but you know what? We can work on that. We can get better at that. So that's I would really try to think about, if you didn't have to say it in front of anybody else, write down truly, what are you not good at? And then think about how you would get better at it. And I would write down 3. And actually, that's what I did. I sat down and I said, hey, these are 3 things that I'm not good at. And actually, I probably still have those notes. I should find those and take a picture of it, put it on Instagram or something, of my weaknesses that I wrote 4 years ago. Because I actually, you know what I did? I took time and I wrote them down, and I had them in that portfolio that I brought. And, it was, and I really wish I could remember what they were, but I recommend doing that. Truly just sitting down, taking some time, don't be rushed. Think about these things that I am not good at, and write 3 of them down, and then write down, how can I get better at this? Maybe I'm nervous talking to doctors, or people in positions of authority are really kind of intimidating to me, but once I get more comfortable, I'm better at talking to them, something like that. And just write them down, and that'll take away some of the that'll take away some of the nervousness. And if you can identify them at first and kind of practice explaining them, you will have more confidence in your voice, and you won't sound weak talking about your weaknesses. You want to sound confident in yourself and say, hey, I might not be awesome at this, but I am willing to get better at it. So
I am going to community college taking prerequisites. I did not have luck with private college, but my passion for becoming a nurse led me to try any option. Do you think I'm on the right track?
yeah. Hey, I went to community college. John went to community college. Did you take any classes at Parkland? No, but still, I mean, a lot of people have gone to, yeah. Loser, you didn't go to community college. I actually got an associate's in applied science at Parkland College in Champaign, Illinois, and then I went to nursing school. And you know what? No one, honestly, even if you got your nursing degree from the associate's program and became a nurse, I think I've only had a couple of patients ask me where I went to school. Only like a handful, and it was just like a conversation thing. It wasn't like did you go to this nursing school? So you're on the right track. You're doing what you need to do. Don't let the whole community college make you think you're not in the big leagues and not going to Duke or Johns Hopkins or whatever. No, I mean, just become a nurse. Follow your passion. Next.
If I have multiple interviews at different hospitals, how do you politely say that? I'm trying to gather all my options before I commit to an offer.
That's good. That makes you look marketable, and that makes us be like, huh. Because that's wonderful. If you can get multiple interviews in the marketplace like it is right now, that's awesome. So this is what I've done is, because I had a couple interviews here. So it kind of depends on how it's set up. So when I interviewed here, in the actual interview, I didn't say that I had other offers. When HR called me back and said, you know, maybe we're interested or whatever, and I said, hey, I actually have a few other offers that I need to consider before I get back to you on an answer. How long do you need, when do you need me to get back to you about how, you know, my answer about this, if you get offered the job? I don't know if it's really necessary to say it within the interview. I'm trying to think of an organic way that would come up within it. I mean, you know, because if you go out of your way to say that, it doesn't look so hot, personally. Do you guys have the same, like, it doesn't look so awesome. It's like, yeah, so I've got interviews across the street, like.
Yeah, I was going to say.
I wouldn't say anything until you actually have an offer.
Yeah. That's what, yeah, I feel like you got to get the offer first, and then you can potentially use that as leverage, but.
You even have to.
Yeah, I mean, that's wonderful if you do, though, if you have multiple offers. But yeah, I don't think when you're actually interviewing with the potential new manager and the other staff, you know, if you're doing a peer interview, I really wouldn't bring it up then.
It seems like she's more so asking, is it wrong to go on an interview when you have other options?
No.
I would say no.
No, you gotta figure out what is going to be the best for you, and you have to kind of, if you've got the option to check out other things, by all means do it. You know, you don't want to just because this is the first place, feel some loyalty or whatever. You got to figure out what's the best for you, and the only way you're going to do that is going on interviews. So yeah, thank you for clarifying that for me.
All right, there are lots. Let's make sure I wasn't, because John's helping me out here.
Thank you, John.
Do hospitals really care about how many organization/volunteer hours you do during nursing school?
I wouldn't say about necessarily the quantity, but if I look at your resume and it shows, hey, I went to Iowa Wesleyan College. Let's say I went to Iowa Wesleyan College and got my nursing degree. My GPA was 3.5. I worked as a waitress during school, and that's my resume. But if you're going to nursing school, maybe you once a week or maybe once every 2 weeks you volunteered and were a lunch buddy at the local elementary school. Like, even though there's not a ton of hours on there, hey, you took some time out of your day, your busy schedule, to go volunteer. That sets you apart. It really does. You don't need to have these ridiculous hours, but if you can have some volunteer work, that does set you apart. What was it? Volunteer and what was that thing?
Just how many organizations and volunteer.
Oh,
so the background here is this person is in nursing school. Professors are encouraging them to join as many organizations, but she doesn't, nursing school stuff.
Yeah. Oh, yeah. Oh, like, you mean not professional nursing organizations, but organizations at school, like to be involved in various extracurriculars?
I think it's that and volunteers, so it's kind of...
Yeah, you don't want to overwhelm yourself. Like, don't, go do a little bit of everything so you can have multiple things listed on your thing. Like that, don't kill yourself. I actually, in nursing school, only was minimally involved with the Student Nurses Association because I actually decided to, instead of doing that, I was a mentor that did this. I forgot Jerry's back there. There he is. I decided to get, certified as a mentor and then, or not mentor, tutor, and do tutoring for nursing students. So I did that instead of doing the Student Nurses Association just because I couldn't stretch myself thin enough to do both. You don't want to kill yourself. If you can really commit to a couple things and maybe volunteer, once every 2 weeks, at the local elementary school, and maybe you do one or two other organizations, that's wonderful. If you're really devoted to a few things, now if you put a little bit into everything, I don't think that looks as quite as great to me, honestly, reading resumes. But if you do have various things put there, it does look good, but it's not like do or die by any means. I don't want you to overwhelm yourself with tons of organizations. That's unnecessary. Don't kill yourself. Nursing school is hard enough. But if you have nothing written, that doesn't look awesome. And I know nursing school is very overwhelming, but if it says like nursing school, no other organizations, wasn't putting your foot out there to try anything else, that's very apparent on a resume. So I think that the right answer is the middle ground. Not doing, do something, but don't do everything because you'll lose your mind. All right.
Okay. If you have a declaratory with the Board of Nursing, am I saying that right?
I don't know what that is.
As a graduate nurse, when would you reveal that information you're intended to?
Declaratory. I don't know what that is.
Maybe that question is from Jessie. Maybe she can clarify.
Jessie
So
or
NRSNG later said, John, see if Katie can answer this question. Okay. So he really wanted this one.
which one?
He really wanted this one answered.
The declaratory. So what
Saying it wrong.
So he is saying, I think like a red flag. That's what he just said. So I think is that
A red flag from the Board of Nursing?
Oh. A red flag from the Board of Nursing. Should you say that in the interview?
yeah? When would you reveal it?
Oy. I have not had that situation come up, so I don't know if I can adequately answer that. I don't know if you would.
I think you get a lot of different answers on this one. Just speaking in general terms of, working with organizations, getting a job, I think honesty is always great, just to say.
Yeah.
So NRSNG says, this is what it is. Petition for declaratory order is a formal disclosure to the board of an outstanding eligibility issue that may prevent an applicant from taking the NCLEX examination upon completion of the nursing program.
Oh, so maybe like a DUI or something like that.
Like a criminal background has to be disclosed with the board of nursing.
Oh, gosh. I gotta be honest. I don't have a good answer for that. And I don't want to tell you the wrong thing. I honestly don't know. And I don't want to say the wrong thing. Can I follow back up with that later? I would think you should reveal that. But I have never been in that situation where I've had somebody reveal that. But I'm also someone that doesn't look up their licensure. We have someone that does that. So I would think that would come up at some point, and I would think it would probably be better to even just reveal that to HR in the first place. And you know what I mean? Like, hey, just so you know, this is an issue that I've got that you're gonna run over because you're gonna look up my license anyway. So I just want to make sure you knew about this in the first place. But I'm sorry. I wish I had more information about that. Next.
Okay, so some of those were answered already. Do you suggest working? Oh wait, no, that one's answered too. Sorry. Nope, that one's answered. Sorry.
I'm glad I'm answering so many questions.
What about this one?
Okay, yeah.
Have we done the do you suggest working on a medical surgical floor as a new nurse?
Okay, yes.
This person really wants to be a NICU RN.
NICU, I'm assuming that means neonatal intensive care, but could mean, yay, neuro ICU. So it kind of depends what you want to do and where you can get a job. I mean, I personally, speaking as a critical care nurse, if I did not have those first 2 years, my transition into critical care as a new grad would have been really tough. And I've seen it work out with new grads in like a tougher area, like an ICU area, but I've seen it not. And you have to be a special kind of new grad to make it work in an ICU straight out. And but if you want to work in the neonatal ICU, maybe not necessarily working on a med surg floor, maybe a pediatric floor, or maybe labor and delivery or postpartum, like kind of the women's health, women and children's services service line. I would try to, if you want to be a neonatal ICU, maybe stay in that service line rather than work in the med surg, because a med surg floor is a totally different world than a neonatal ICU. But if you're talking neuro ICU or you want to work adult ICU, I highly recommend working